financial benefits, you know, once you get to DevOps and everything's programmatic, we went from 35 down to 5. Uptime went up. The overall costs were more tied to the level of the business. And then I think the other thing that people are surprised to hear is that our availability actually goes up in the cloud. And we're going to talk about that a little bit later. But, you know, you have disaster recovery capabilities that aren't available in traditional models that you were able to leverage on a regional basis and on a system-wide basis, which were pretty interesting. So, all right, so we'll step into the process here. So, and again, this is the process that you gave me way back when. There's really 3 movements to get us to the cloud. One is to establish a business case. Second, to architect and plan, and then the third to migrate and operate. And under each one of those, there's a handful of steps and movements, and we're going to touch on those. So the first thing under establish a business case, you have a readiness assessment, and I think the thing that people will be interested to hear is not every health system is ready to go to the cloud. So why is that? Why do you think? What makes one health system more ready than another to move to the cloud?
I don't think we've ever talked about this, right? And at least the simplicity of it, right? I think the context is organic growth versus, you know, measured growth. And then most health systems that I've seen have grown organically. Like, I'm going to buy this system or that system or that system, and just keep adding on to the Band-Aid ball, but as opposed to, you know, logical and methodical growth. You know, we know we're going to grow by a factor of X year over year, and we're going to plan for it. And I think that's kind of really at the epicenter of why, from what I've seen. Because coming from other industries, we've done that. You know, it's coming into healthcare, I've yet to see that logically thought through.
Yeah, I think the other thing we've noticed is that some health systems still don't have a handle on the basics, on the basics of blocking and tackling. So when we go in there, like for example, you know, when I came in as CIO, I asked, okay, I would like a list of all the organizations that we're connected to and what data we're sharing. That took almost 6 months to a year for me to get that list. So organizations that have trouble with the basics of, hey, can we have access to this data, this information? Do you know where your contracts are? Those organizations need to, I mean, not that it's an insurmountable hurdle, because we got through it. And, but, you know, being able to have access to that data, even though it's, you know, a lot of times we can just take raw data and process it. Just knowing where it is and having access is one of the things. So, you know, what are some other things you found in terms of organizations being ready?
I think process maturity is a key, right? So standardization, and this is not process for process sake, is do you have standard repeatable processes that a large portion of your staff follow? And in a lot of cases, it doesn't exist. And that's the baseline for building blocks of automation and kind of growth from that. So, you know, building on what you said, like asset management is one key, but do I have standardized procedures for patch and reboot or change or things like that? So if it's measured and applied consistently across a larger part of the organization, you're much more mature and ready to take those leads rather than you have to set those building blocks into place first.
So if they've done ITIL and those kind of things, you're going to be in good shape, I would assume.
Right.
All right. So the next step is to establish the point of truth. And, you know, I found this interesting because, you know, for me, you came in and started dumping all this information on me, and it didn't match with what the organization had told me, you know, prior to you doing this deep dive into our information. And to be honest with you, I was a little defensive because I'm looking at, you know, we had just done a Microsoft agreement based on information that Microsoft had given us. So they had come in and done an audit and said, hey, here's all the stuff you have. Here's what you should license. So that's what we licensed. And then you came in, did this deep dive and came in and said, hey, you over licensed by about, you know, $1.5 million. And I got defensive because I'm like, how can you say that you know more than Microsoft, who has all these tools on my environment? But give us an idea of what it means to establish the point of truth and how you get to, really that that starting point for the cloud migration?
So a lot of your, we'll say your source logical systems have the data of how you actually use IT from a licensing perspective or a consumption perspective. So Active Directory, for example, in there you have every user that's going to log in and every account that's going to do it, but not every account is active. So when you start looking at it, like how fast and frequently do I actually DTOM or kind of terminate my accounts in there? And that was one of the problems that we had is, we had approximately 50,000 Active Directory accounts, but 15,000 of them have been fallow for multiple years, meaning that we don't use them at all. So we were licensing for the wrong amount for that. The same thing applies, in most other areas, right? So we never do a good job of rationalizing down. Right? We can buy, we could acquire, we could build, but what's our lifecycle management process? And that's kind of one of those, easy sacred cows to go after first and foremost. To say, how much have we been decommissioning over the years, which is almost yearly then.
Yeah, I think I found it interesting that you go after source data. I mean, you literally are just saying, hey, just dump me the raw. I just want the raw data out of Active Directory. I want to look at the physical contracts. You really, this process, you go back, and one of the things you sort of drove home to me is that every report I'm seeing has a bias or a purpose or a bias, right? It has a bias to make something look a certain way, or it has a purpose that it was designed for, and I might be using that report for a different purpose. So talk about why you go back to source data and how, and why that doesn't take forever. I would think if you go to source data, it would just take forever to get that done.
Well, I mean, and you're right, and that was part of our journey together too, right? It's that generic performance and asset reports are just that, they're generic. They don't apply to the way you actually use it. They apply to the way the tool is done. So when you look at the problem from a tool perspective, you're solving a problem with a hammer when you actually need to build a house. When you go to the raw of the data, you're looking at actually how you're using it, and which is really the key, which takes a little bit more time up front, but it moves a lot faster once you lay out all the cards. So like when you're solving, putting together a puzzle, for example, you typically look at the edges rather than starting in the center. And that's kind of the approach that you have to kind of look at it. Like, how am I actually using it, and what am I actually doing with it first, which allows us to move faster once you get the edges of the puzzle figured out.
Yep, absolutely. And so, and then we, you have this point of truth, and then you establish the business case itself, which closes out this first step. And in the business case, you have things like financial models, you have usage, you have skills, you have, I'm actually shortening this up for purposes of the show, but there's a lot of elements of this business case. One of the things that the combination of you and I really works, as people can tell, you're very analytical, and I like to tell stories. And so I really strongly encourage people to tell the whole story of how healthcare transitions in this process. And then you come back with just all this supporting data in terms of how agility is going to play out in the organization, how there are cost savings, even though people need to be aware of the fact it's operational dollars versus capital dollars in a lot of cases, and some organizations struggle with that transition.